Is this normal? I'm a facial plastic surgeon, Dr. Rich Castellano with ImageLift. This is my series on Is This Normal? Acne or pimple, is that normal after having procedures, facelift, eye lift? The answer is it can happen if you're using Vaseline or bacitracin. Moist wounds heal the best. When you use that on the skin, sometimes the pores can get clogged. So little pimples, little eruptions can be normal. If you see a lot in one area, that is not normal. And a lot of pimples looking like almost a rash, that's too much. One or two here and there is normal. A big rash and a lot of little pimples, not normal. You need to talk to your doctor. Bruising that changes colors after procedures. Some procedures you have little or no bruising, and some of my patients are on blood thinners or bruise easily. They can have a lot. And as the bruise fades, it's very normal that it will change colors, from purple to dark brown to sometimes greenish and then fades away. So yes, it is normal that the bruise changes color, but if it's a painful bruise getting worse, you need to let your doctor know. Signs and symptoms of infection: redness, swelling, drainage, pain, fever. So if it's a bruise that turns red and is very painful, let your doctor know. Feeling lumps or bumps after a facelift, is that normal? For a few days, 4 to 7 days, you may feel areas that are firm, bumpy, and they don't feel quite regular. And you say, is this normal? And the short answer is, yes, it is. Always have your provider check it out and confirm. Remember, signs and symptoms of infection: redness, swelling, drainage, pain, fever. It's the trend that matters most, but little bumps here and there settle. And here's what I do for patients. When they feel on their face, it feels firm right in these areas. I say, let's feel right here. This feels pretty normal. We didn't work down here. They're like, yeah, that skin feels normal. I feel up high on their cheek right here. I say, yeah, that feels normal. And they say, feel this? This feels firm, and feel the bumps. This is going to feel just like this and this. This is your comparison here. So these feel normal. The rest of the skin will feel normal, but for 4 to 7 days, sometimes even up for a couple of weeks, you may feel little bumps that are normal that you may not necessarily see. And yes, they can be normal. Permanent fillers look and feel normal. We use 𝗿𝗏𝒃. It is a permanent filler. It has FDA approvals for use in the face, and the answer is yes, it does. Most people, when they feel their fillers, they say, feels like my normal skin. They don't feel it, but they know something's there. Some people will say, well, I feel something, but I don't see it. It doesn't bother me. We leave it alone. I don't think it's necessary you have to make an incision to take a nodule out. If you feel a bump and it bothers, it's collagen, and you can break it down. So do fillers feel normal in the face? Permanent fillers feel normal in the face? Yes, they do, and it is the most popular choice in our practice. You want peace of mind for your facial cosmetic procedures and treatments? Follow along for answers that you need to feel your best and make your best decisions.